Citizens, I repeat, must play their part. We have to take a whole of society approach. The truth is, without compliance with the DRMA regulations, we risk undermining the efforts of the government, and indeed the government of the efforts of the people who comply, because one action affects all of us. These regulations will not be effective if people do not comply. Our assessments are showing, as I said earlier, a positive relationship between the implementation of our DRMA regulations and lower rates of COVID cases. Compliance is therefore absolutely essential. Jamaica remains in community transmission, and every Jamaican has a responsibility to cooperate with the government, to take personal responsibility to protect themselves, their loved ones, their communities, and the country by observing all the critical protocols that you should know by now, but we continue to repeat. I want to say that so much has been said about this allocation, and as a government, we are very sensitive to public perception, and we do know that many felt concerned, not to use a stronger word, that we may have been spending so much money on an activity that perhaps could otherwise be spent doing other things. There's value in all the arguments that are advanced. So I would not be the one to pour cold water or to be critical of some of those concerns. We are responsive to concerns. And in this period of time, we need all hands on deck. We need everybody involved. And the truth is, the challenge that we face evolves. So yesterday it was of a particular nature. Today it is of a different nature. And in this case, it is about greater levels of hospitalization and a requirement for staff. It is true that a number of Caribbean countries are in fact administering vaccines to their population. And I know that has created some anxieties within the country as to why it is that Jamaica is not doing the same. The vaccines in the region are being have been sourced from one source, and that's India. And I want to commend the Indian government, the Indian people, for making the offer to the Caribbean, a number of countries, including Jamaica, by the way, for that gift. It's an important gift. And for those who have received, I think it's commendable that they have initiated and taken advantage of that. But it's one source, and it's a gift. No Caribbean country has been able to source vaccines from any other source and paid for vaccines. I think there may be one other Caribbean country that got a small gift from another source. And I'm not going to name the vaccine companies or the countries, just not to offend anyone. But I think that's important. Now, that source, having given the vaccine to 3 countries, 2 in the English-speaking Caribbean, that quantity was then redistributed to a number of other countries, and the smaller countries in particular. And the amounts that they have received, in some instances, important to them, of course, and that's a good thing, are relatively small amounts, certainly not enough to provide the kind of impact to their population. So whether it's 1,000 doses or 2,000 dosage and so on.